before we begin with Kim's presentation. I would like to acknowledge that I am on Treaty 8 territory, which is Northern Alberta, and it is the home of the territorial home of First Nation, Métis, Inuit, and has been for a millennium. And we settlers are so fortunate to share this land with them. And without further ado, I would like to present Dr. Kim Raine. She is a distinguished professor in the School of Public Health, University of Alberta. She is a registered dietitian and a fellow of the Canadian Academy of Health Sciences. Dr. Raine's research moved nutrition interventions upstream by pioneering social ecological thinking in nutrition, as well as demonstrating the potential of large-scale population interventions at community and policy levels. For the past 7 years, she has led Alberta's annual nutrition report card on food environments for children and youth, monitoring food environments and advocating for health promoting change. Dr. Raine held competitive career awards for 14 years, including an applied public health chair from the Canadian Institute of Health Research. She has led research teams that have garnered over 20 million in funding, published nearly 200 peer-reviewed papers in high-impact journals, mentored over 60 Masters of Science and PhD and postdoctoral research trainees, and influenced research strategies and policy development. In 2020, she received the Ron Draper Health Promotion Award from the Canadian Public Health Association. Wow, Kim. And thank you very much. And it's all yours.
Thanks, Wanda. When I hear that type of introduction, it just reminds me of how old I'm getting. But I would also like to acknowledge that I am located, and the University of Alberta are both located on Treaty 6 territory. And as Wanda said, traditional home to First Nations, Inuit, and Métis, and also very respectful of that sharing of that land. So I am going to talk about Alberta, so not the state of the nation, but the state of the province. I am going to talk about food environments for children and youth in Alberta. I'm going to talk specifically about those in the school setting and from Alberta's nutrition report card on food environments for children and youth. I will say that I'm at a bit of a disadvantage, is that all I can see here are my slides. I've tried to figure out how to see the chat. I can't. So if there are questions or if there are problems seeing the slides, please just interrupt me and we'll figure it out. So for those of you who perhaps were not at the presentation last year, the Nutrition Report Card has been going on since 2015, and this is our 7th annual and final, actually, installment of the Nutrition Report Card. We started the report card, we were really inspired by Participaction's physical activity report card, and we thought we needed something about nutrition, really to talk not about what kids are doing, but what the opportunities are for kids to consume healthy foods. We're really looking about food environments and those opportunities. And so one of my colleagues at the time, she was a postdoctoral fellow working with me. She's now an assistant professor in at the University of Calgary. Dana Olsted helped us to pull together the initial report card, and then we've had a team since then on an annual basis. We basically pulled together the report card through this review of literature that Dana led, and then we had 20 Canadian nutrition and physical activity experts, including those who were involved in the physical activity report card, to identify some key indicators. We ended up with 40 indicators that we have collected data on. They have morphed a little bit over the past 7 years, but there were 40 in 2021. And those 40 indicators are actually, we have developed benchmarks, and in other words, what those indicators should look like. And that's what we grade against. There is a conceptual framework. So those 40 indicators fall within 5 food environments. Basically the physical environment, things like what's available, the communication environment, what messages are kids receiving, the economic environment, how much does it cost, the social environment, sort of what are the norms and values, and the political environment, what are the rules, what are the policies that are in place that help to support this. In terms of grading, we look at each of those 40 indicators. As I mentioned, we have a benchmark, and basically it's simple. If the data that we collect shows that we've met the benchmark, they get an A. So that's, and you'll see how this works as I go through some of the grades. However, if they don't meet the benchmark, we don't automatically give an F. They may somewhat meet that benchmark, maybe halfway. Maybe there's policies in place that aren't fully implemented yet. So there is a little bit of a gradation. And then, but if the benchmark is not met at all and there are no policies in place to help us move towards that, that's when we give an F. Sometimes we don't have enough data, so we have to give an incomplete. What's different in 2021 is that for the past few years, we've been working with local communities, about 14 of them in Alberta, actually, and we've partnered with the local health system, with community health facilitators and dietitians, and we've developed mini nutrition report cards. The communities that we've worked with have identified healthy eating as a priority for action, and we've worked with them to help them collect the data. They've collect data using an app. They use their smartphones or tablets to answer an online questionnaire, and I'll talk more about that a little later. But it's things like what food is available in their local schools, what nutrition policies are in place. They capture pictures of menus and vending machines on their smartphone and send that back to the university, where we do the grading, and then they come up with some recommendations for their own community. So the 2021 provincial report card includes aggregated data from those individual communities that have helped us. So let's get to the results. The 2021 nutrition report card on food environments for children and youth, we gave the grade of a D. This is the first time since 2016 that we have not given a grade of a C. In 2016, we also gave a grade of a D, which followed a cut of many of the children's health promotion and nutrition programs that were started in the mid-2000s. And this year we also gave a D, so it really is the worst grade we've given in the full 7 years of our history. If you want a quick overview of what the report card found, we ended up coming up with an infographic that has a traffic light labeling system, what's stopping kids from healthy food environments for kids, and let's give kids a green light for health. Those indicators that we shaded in a green, which were very few, 4 out of the 40, got A's. Those with red were the D's and F's, and that was about half. And then C's were those in the middle, and those were the yellows. So let's go through those individual environments. In terms of the physical environment, which is what's available to kids, we gave an overall grade of D. Specific to schools, in the school setting, our benchmark is that 75% of the food available in schools should be healthy. And healthy food meant that it meets the choose most often or choose sometimes according to the Alberta Nutrition Guidelines for Children and Youth. Basically, in terms of the schools, the benchmark was not met, and I'll show you the data that shows that, but we do have those Alberta Nutrition Guidelines in place. They are voluntary. That ended up giving us a final grade of a C. It has pretty well consistently been a C for the entire time that we have had the report card. I'll show you the data. We used data from the Alberta Nutrition School Nutrition Program, knowing that these nutrition programs originally followed the Alberta Nutrition Guidelines. In 2020, so prior to COVID, and Mary might have an update on this in her presentation, there were about 40,000 students who were receiving the Alberta School Nutrition Program. Unfortunately, that's only about 5% of Alberta students, so we didn't see that as adequate. And we really did have a lot of questions around the impact of COVID-19 in our understanding from talking to people who worked with the Alberta School Nutrition Program. They no longer had to demonstrate that they met the Alberta Nutrition Guidelines, that when schools were closed, many of the kids were receiving their school nutrition through community groups and voluntary community agencies. So we are not certain about the nutrition quality of that. We did have data from the Compass study that showed us about 73% of the food and beverages in vending machines were considered choose least often products. And then from five of our communities that collected data in schools, in 24 schools, these were the local communities, about 45% of the food that was offered was considered choose least often. So we didn't meet the benchmark. We gave the C because of those local communities did a little better than what the data that we had at the provincial level. Also in the physical environment, we don't just look at what's included within settings, but we look at what's included around settings. And so in terms of an indicator, traditional convenience stores and fast food outlets, we like to see a buffer of about 500 meters around schools that don't include these types of outlets, based on research demonstrating that this is better for kids' health. We gave a final grade of F this year. For the first time, we had traditionally given mostly a D. And that was based on the fact that in the larger cities of Calgary or Edmonton, only like less than 30% in Calgary and less than 25% of schools in Edmonton had no unhealthy food vendors within 500 meters. You know, the opposite, about 25 to 30% had 5 or more. So that's not a good case. And it's not just in the big cities. We also took a sample of what was happening in some smaller communities. These are data from High Level and Westlock. In Westlock, all of the schools had unhealthy food or beverage outlets within 500 meters of the schools, where in High Level there was one that was okay. So not looking good in terms of the physical environment. In terms of the communication environment, we gave again an overall grade of D. And that was predominantly related to, again, in the school environment, it's related to the nutrition education provided to kids. In the school environment, we did better than a D. We actually gave a B and a B plus. Which has been pretty consistent over the 7 years, in that basically the benchmark is that nutrition is a required component of the curriculum at all grade school levels, and it is mandatory up until grade 9. So that's why there was a B grade. We also looked at food skills education, in particular things like home economics and such. We had traditionally given a D over the 4 years that we collected that data, because it is not a mandatory part of the Alberta curriculum. We upgraded to a C in 2021 based on the fact that many of the small communities that we looked at, even though food skills were not considered a mandatory course, often they didn't have a whole lot of other options, so it ended up being mandatory by default. So a lot of the smaller communities are still providing food skills to their students. In terms of nutrition education and training provided to teachers, we gave a C in 2021, which was consistent with the last 4 years. And the reason being is that it is not, nutrition education and training is not a mandatory requirement for teachers, except for University of Calgary provides one mandatory course for students. So therefore, we ended up with a C. In the economic environment, we tended to do very poorly. We gave overall for the economic environment for all settings, not just schools, an F. And in terms of schools, this isn't specific to schools. The charging of higher prices for unhealthy foods, and our benchmark was putting a tax on sugar sweetened beverages sold in any form. So again, that's not specific to schools. We don't have that tax. It's something that's coming in Newfoundland and Labrador in 2022. And so it's certainly something that could be considered. So we have consistently given an F for this. But the reason I included in this presentation is that we have done some calculations around the estimated healthcare cost and revenue in Alberta if we did have this 5-cent per liter tax on sugar sweetened beverages, and it would be about $186 million a year, and that could easily be used for universal school food program. So that's the reason I've incorporated that into this presentation. We don't have good data on whether or not there's a subsidized fruit and vegetable subscription program in the schools. We had been giving a C because of these Alberta school nutrition program included fruits and vegetables. And so for a subset of our population, there was that happening, but we don't have that data based on the impacts of COVID on that program, as I discussed earlier. With respect to the social environment, we generally gave a C. Relevant to schools, we're looking specifically at whether or not weight bias is avoided. And so our benchmark is that weight bias is explicitly addressed in schools through policy and practices that promote body size and shape inclusivity, and curricula that focus on health, not weight, and implementing strategies to mitigate weight-related bullying. Certain schools in the post-secondary area have some programs and policies in place, but they are voluntary. So we have pretty consistently provided a D for this indicator. With the political environment, in terms of schools, we were doing a little better than a C. We don't, in one area in particular, compliance monitoring of policies and actions to improve children's eating practices, we're giving a D because we're not really following, we're not really monitoring whether or not schools are using the Alberta Nutrition Guidelines and whether or not they're adopting them as relevant for their schools. So that's why we have the low score of D. We have, however, consistently given an A for having food rating system and dietary guidelines for foods served to children. And those are the Alberta Nutrition Guidelines for Children and Youth. Although I have heard that recently that those may not be used as consistently as they have been in the past. So that's a question that we may be looking at in 2022. We also have added a new indicator in the past 2 years, and this year we were able to actually collect data on that, and that is whether or not food procurement contracts or agreements signed by public institutions such as schools specify that at least half of the foods procured are healthy, and that is not happening at all in the school setting or elsewhere. So just to give you some future directions, this is the final report card. There won't be another. However, we are developing a mobile app so that this is something that can continue to happen in local communities for people on their own. And we are also part of the International Network for Food and Obesity Non-Communicable Disease Research Monitoring and Action Support Group, or Informas. And there is a group in Canada called Informas Canada who are aware of this work and monitoring food environments and may hopefully adopt our app. Just to give you a little preview of what the app looks like, this is my phone. And there is this little app here, and it looks like this, benchmarking food environments. And if you go into the app, it will ask you what setting is of interest, and we can collect data not only in schools, but in childcares, rec facilities, public buildings, restaurants, grocery stores, and assess community resources as well. So I've checked school here, and then you name the schools that you want to collect data for. I actually didn't collect data in these schools. I just I chose schools that I was familiar with in my neighborhood, and then made up some data as I was testing out the app because it's not ready to go yet. And at the schools, you can collect data on available food, food-related policies and tools, healthy food procurement, whether or not healthy food costs less, if there are food outlets close by, the weight bias, healthy food promotion, and food marketing. Many of those that I've already shared with you. Just to give you an idea is that, people go through and they say, okay, in the cafeteria, they check off how many of each products are offered. And then in the back end, we have the Alberta Nutrition Guidelines, and we've rated all of those foods according to where they fit. And again, the app will automatically calculate it out whether or not you've met 75% or not. And basically, rather than give a grade of A, B, C, D, or F, we have simplified it a bit to that traffic light labeling. Red is did not meet the benchmark, yellow is somewhat met the benchmark, and green is met the benchmark. And so this is the printout that a school would get that shows how they're doing. And if you press on the little information button, it will tell you, give you some resources that can help you to improve your score. So I'll finish there, again, showing the overall report card infographic, which can be downloaded from the Alberta Policy Coalition for Prevention's website. And I'll leave that up for a minute if you want to take a look. And that is the end of my presentation.